Dr. Ishmael, thank you for agreeing to be with us today. You're a senior fellow at the Policy Center for the New South. You are now operating from Brussels, specializing in many subjects related to the European Union and its relations with other regions of the world. Thank you again for agreeing to give us some insights on the situation in the Union. We noticed lately that there is a bit of frustration within the EU, whether it is from those who think they have not been supported, or those who think that some countries have mismanaged the health crisis. Which brings me to my first question. The EU does not have binding prerogatives in the area of health safety, but it has more of a coordinating role. This flaw has been all the more highlighted with the widespread of the virus in many countries, which has called into questioning the solidarity of European countries among themselves. Do you think that this crisis will mark a turning point?
I think that there are several bits and pieces in this question. And first, perhaps we should start the conversation with talking about the competence, and you're quite right. I think it's fair to say that the EU's competence lies with respect of a coordination role. But the issue of health policy and decisions with respect of drugs and hospitals and utilization of beds lies firmly within the competence of national states, member states. And so perhaps we can also ask questions about, is the EU Treaty of Maastricht flawed in that respect? Maybe, maybe not. I mean, we now have the luxury of hindsight, and it's always so many more things come into play when you take a look years later at things that could have been. But the fact of the matter is, when countries are coming together in an economic union, you can only go as far as what I would call the political traffic will allow. In the Caribbean, as Director General, putting together the economic union for the 9 very, very tiny countries that I represented at the time, we could put all sorts of things in the new treaty, and they were binding and they were given legislative effect. But we couldn't go further than each individual member state said that they were willing to go. So I think that in the early beginnings of the formation of the economic union, that there was a good deal of honorable intent, but also there was a very good understanding that issues of sovereignty, even while states might willingly pool some aspects of sovereignty, that there are also aspects of sovereignty that they will hold for the exercise of themselves in their national domain. And it's only when we have an unprecedented crisis, perhaps, in the health sector such as this, that it raises questions. Did member states cede enough competence to the EU in terms of the coordinating role that was required today? But again, first, we have a pandemic of unprecedented proportions, not just from a health point of view, but socially and economically and politically. And so it raises really important questions about the treaty itself, and perhaps we can come to that. But even though we went into the pandemic with 27 different responses to it, there is now an understanding by member states that they would like to differentiate or to design the exit strategy in a common way. But even as they've made these decisions over the last couple of days, for example, this week, a couple of things have come up as well. They have decided, yes, we will coordinate our exit strategy because, of course, there's been lockdown situations across Europe. But they have agreed to do it with several things in mind. And the first is that the epidemiology, and there's some words I don't pronounce very well, the nature of the virus is not the same across Europe. Not the nature of the virus, but the ability of each member state to deal with the virus is not the same. Capacities are different. So the scale and the depth of the virus on the one hand, and medical capacity in different hospitals will be taken into consideration as together they decide how to exit. So countries that are worse hit or still don't have the capacity to handle more if there's a second wave, clearly will not start the de-escalation process in as quick a way. And I think that that's fair. But they've also gone further than this. They've agreed that they will provide guidance for the public together, that they will undertake surveillance and monitoring and have common guidelines for surveillance and monitoring in place as a single Europe. However, the questions of solidarity remain, because when Italy, of course, was the first one to literally beg for many, many weeks for support, what we saw in Europe instead was that traffic was stopped at the border. People coming out of Europe, out of Italy were turned back. Medical supplies were stopped at national borders and kept for domestic and national use. And there wasn't the pooling of resources that one would have hoped for. And I mean, there's also an understanding perhaps that we could take another look at it and say, well, the truth is national governments honestly didn't know what they were facing. And so they were in fact holding supplies for their own use. But still one would have hoped that the EU would have had a better mechanism for dealing with what surely was going to be a pandemic across Europe, because their borders to each other are fairly open. Where are we now? Is there a turning point? I honestly don't know. What we do know is that whenever we've had a crisis, all of the divides within Europe become very, very clear. And Italy, Greece, Spain, Portugal, for example, in the refugee crisis in 2015, were very concerned of the lack of solidarity with respect of migration and refugees. Mm-hmm. In 2008, with the financial crisis, we saw the same thing. The southern economies were the ones worst hit. They were put under austerity measures, and as a result, they had to sell out a lot of national state-owned assets, including very important ports, the largest ports, the largest railways, airports as well, and China came in and bought them all. So the issue of solidarity comes up whenever there's a crisis, whether it's a health crisis, a financial crisis, it comes up. And at some point, Europe is going to have to make certain fundamental decisions with respect of the question of solidarity. What they have agreed to do right now, the new commission had determined that in May and early June, they would have had widespread discussions with respect to the future of Europe, the Europe that we want. But those, of course, have been pushed back, I think, until the fall, until September and October this year. And while it was not particularly envisaged that the treaty was going to be coming up for any particular debate beyond what Europe do we want, but there are now speculation that certainly when one takes a look at health, that the treaty may need to be reviewed with respect to the competences that are shared between the national levels and the EU level. But they have gone forward quite a bit with respect to certain measures. The structural package measures that they have agreed to is significant to take care of workers and businesses, as well as the financial sectors. So they are moving to the extent that they can, but the issue of solidarity, I think, is an important one. And what happens later on in the year with respect of any review of the treaty is going to be a little bit compelling as well. And the latest thing that they have asked for today, the EU as a whole, to start discussions about liberalization of medical equipment that might be required for future pandemics. And that would free up something like about 580 billion euros worth of trade in medical equipment. So we'll see.
Okay, so now from an economic point of view, the EU's united economic response comes up against the inflexibility of the Netherlands, which together with Germany has rejected the principle of a joint debt as a way out of the crisis. Do you think that we are now witnessing a North-South divide in Europe?
Well, I don't think that we're only just now witnessing a North-South divide. I think we've witnessed the North-South divide before, certainly in 2008 with the financial crisis, but there's also an East-West divide as well. But these are historic fractures in Europe, right? I don't think that they're new at all. What we have seen, however, in this pandemic is that France and Germany have wanted to bail out countries that have been hardest hit. And the Dutch are the ones who've been inflexible. Behind the scenes, France and Germany have played a leading role, which is strange for the Germans, but they have played a leading role in trying to bring all the sides together. The Dutch have been a little bit more difficult. And at odds really is two things. One is the sense from countries that have been worst hit that they would like resources to help them cope, because it's not their fault that they're the worst hit. Well, we could argue about that, but really and truly, it's not because they've been fiscally imprudent why the economic costs for them are going to be that dramatic and that high. So they said, we want a mutualization of all the costs associated to this, and as a united Europe, we will pay off that debt. And then people like the Dutch are saying, wait, hang on a second, we don't mind offering some sort of a loan for this period because it is exceptional, but our taxpayers shouldn't be paying for something that we're not fully needing to shoulder at this point in time. And we don't want debt to be mutualized. We don't mind a one-off thing, but we don't want to be setting a precedent now to deal with mutualization of debt. We will use the European stabilization mechanism, we will use other mechanisms, but this issue of mutualization of debt, which in fact for many years has been viewed as one of the weaknesses of the Eurozone, for example, that in times of crisis, those who have more and are economically more healthy are not able to work with those who are really hitting the rocks with respect to their economic, what they can in fact do. So this is a question that even if it's deferred right now, it's going to come back time and time again to haunt the EU, because the issue of mutualization of debt in an economic union might be one of the things that one would expect to see. And the issue of the North-South divide, well, I mean, there is a North-South divide, which is a historic one. But it really is also based on the fact that economic structures are quite different. The economic structures, the structure of the economies of northern countries like Germany are quite different to those of Spain and Italy, which are more services driven as opposed to manufacturing and industrial. So those are different as well. But there's also an East-West axis, which is very, very important, which is a divide between West and Eastern Europe. And we saw it again at play when China stepped in and provided support to Italy, followed by Russia. But China too was working with the configuration of the 17+1, the one being China, 17 being the 17 Eastern European countries, 11 of whom are EU members, with whom China coordinates in a very progressive way in terms of how it supports them, its investments, and even right now, in terms of the pandemic, and coordinating with them, supplies to them in response to their needs. So all of these different axes in a sense, whenever there's a crisis, they come into play. And whenever there's a crisis, then there are questions about the amount of tension that the EU as a whole can bear, given these divides which are historic, but which other countries are also using to deepen and further their own influence and power. In fact, one of my latest papers, which was recently published just 2 weeks ago, was on, the title, The Making of a Superpower, How China Uses Crises to Deepen and Expand power and influence, not just in Europe, but around the world.
Yes. So the EU Commission announced 15 billion euros for the global response, while it is still struggling with its own budget.
Right.
Can you tell us what part will be allocated to African countries?
Okay, I think there are different levels to this as well. When you take a look at the way in which the EU is farming out that particular resource, it's clear that Africa will benefit in different ways. One, in terms of what the EU is doing globally, what the EU is doing EU-AU, what the EU is doing bilaterally with certain member states within Africa, and also what the EU is doing with the African, Caribbean, and Pacific group of countries. So if we look at the global level, the EU will argue that Africa will benefit because they're doing quite a lot with respect of providing some of that financing, an enhanced amount of financing to the WHO, as well as to Gavi. I think they're providing something like 200 million of that money to GAVI, I think we can just call it Gavi, to deal with working as quickly as possible with respect of providing vaccines for people around the world. Because until we do that, I don't think we're going to be fully out of, maybe out of the crisis, but waves of it perhaps. So that's one level in which they're working. And Europe's support for WHO, given the, well, I won't say unprecedented, but given the American president's recent announcement that 400 million that is normally paid to the WHO by America will be withheld for reasons which we are now all aware of, leaves a big hole in the funding for the WHO. And I'm not quite sure how that gap is going to be filled, whether or not the EU will take additional responsibilities with respect to that. So that's at one level, the global level at which Africa will benefit. And then if we take a look at continentally, the EU has says that they are going to put aside 3.25 billion for Africa, of which 2.06 billion will be utilized for sub-Saharan Africa and 1.19 billion for Northern African countries. They also expending as well something like about 16 million euros for clinical trials. And there were 14 EU member states as well as 16 African member states will be involved on those clinical trials of a new vaccine. They're spending 80 billion on the EU platform for African testing, which is to build new labs to deal with the testing across Africa. They send in 5 million euros to the African Center for Disease Prevention, really to scale up capacity there, research and outreach. They deal in bilaterally with funding to Nigeria, Ethiopia, Sudan, Sierra Leone, Morocco as well, Tunisia, Egypt, and particularly in the case of Tunisia and the Northern African countries. Tunisia, for example, will get 250 million euros to deal with the issue of migrants and to make sure they are tested and to deal with that particular issue. At the level of the African, Caribbean, Pacific group of countries, they've allocated 291 million, together with 25 million to the WHO and 30 million from a fund, a facility which is known as ECHO, which is the humanitarian assistance. And of course, in the ACP, out of the 291 million, African countries will get the lion's share of that because the populations are much, much bigger. And when we take a look at that and, take a look at what countries like, or regions like the Caribbean will get, the scale is completely different. So the Caribbean region will get like 8 million euros, as opposed to these hundreds of millions of euros and dollars that we're talking about with respect of allocation to Africa. So, and these numbers could change, they could increase, but I think perhaps one area which is really, really very important is the EU solidarity with the AU on this issue. And we saw it very recently in this very important letter, which was signed off by various prime ministers of Africa and presidents here in Europe, together with the AU officials and EU officials, asking for debt relief, asking for drawdown rights to be redrawn at the IMF, asking for the World Bank, G7, G20 to do everything that can be done, working together. And I think, you know, the marquee on this letter is very important. It said, you know, pandemic is not won until it's won in Africa. And I think that's true as well.
So I had the last question about the common plan for the management or the common.
I'm sorry, can you repeat it? We froze.
Yes, sure. I had the last question about the common strategy of the EU for the exit of the crisis. I think you have answered mostly the question before, but if you have something to add, maybe?
I was going to add something at the end, but I actually wove it into the response when I answered at the very first time. And it had to do with the question of the turning point and what was going to happen with respect to the review of the Europe we want, and the thinking that now perhaps the treaty will also feature in that review and not just policies. I think it was mainly that I was going to add.
All right, thank you very much for this very interesting conversation.
You're very welcome.
Thank you, have a good day, stay safe, and I hope to see you very soon.
Well, yes, when we hear that Morocco's borders are open again to
yes, hopefully, yes.
Okay, perhaps in the fall, sometime. Okay.
Hopefully. Thank you very much.
All of you, stay safe.